Peter Thomas from Washington, D.C., General Counsel of the NAAOP, the National Association for the Advancement of Orthotics and Prosthetics. Wanted to bring you up to speed on three main issues this summer, midsummer, before Congress goes on its annual August recess. The first being that the House Committee on Energy and Commerce marked up this week legislation to permanently fix the physician fee schedule. That is a perennial issue that occurs virtually every single year and vexes Congress to try to figure out a way to decrease the impact that such a magnitude of 25-30% cut to the fee schedule would have on physicians. This year, there seems to be coalescing some kind of an approach to fix the fee schedule full-time, long-term, rather than a one-year approach. The problem is that they haven't figured out a way to offset the cost of what that will take to do so. Later this fall, the Congress will begin in earnest to try to find some offsets, and in that context, O&P and all providers are under a tremendous threat that they will be selected to help offset the cost of the change to the physician fee schedule. However, there also are opportunities whenever a Medicare bill goes through Congress, and we certainly as a field have the O&P Medicare Improvement Act and other legislation that we hope to attach to and move in this Congress. I also wanted to bring people up to date with respect to the recovery audit contractors and the claims and the audits that have been occurring throughout the country. Just within the last couple of weeks, there's been a flurry of activity related to RAC audits, and there's been frankly some confusion, and I might add some confusion on behalf of CMS and its contractors with respect to this issue. Let me just say that it's a little unclear exactly what happened. There was a sense that the contractors, including all the RACs, were going back and considering rescinding a number of the appeals that had occurred prior to August 2011, meaning claims with dates of service prior to August 2011. However, when investigated and when we approached CMS, it was pretty clear that one hand didn't know what the other hand was doing. And so, unfortunately, we're hearing differing types of information about whether those cases will remain rescinded, whether CMS will continue to rescind cases that were overturned that occurred with dates of service prior to August 2011, and simply we'll keep you informed as we learn more. Finally, with respect to O&P documentation, CMS plans to and seems to be set on course to create a physician template that will assist physicians in filling out proper documentation for orthotic and prosthetic claims, in particular lower limb prosthetic claims. They've held now 2 open-door forums where NAAOP has participated, along with many, many others in the O&P field. And we've registered our viewpoint of these templates. We feel the templates really focus way too much on comorbidities, on the condition of the individual, and very heavily reliant on and focused on medical status, and not nearly enough on the functional status of the individual. And that, of course, is what determines the potential functional level of the individual that correlates to the type of prostheses the individual can receive. So we've made those claims clear. We continue to be in active consultation with CMS on these issues and submitting comments both individually and in concert with the Orthotic and Prosthetic Alliance organizations. We very much appreciate your support and look forward to the next webcast. Thanks so much.